Welcome to the JOWMA podcast, presented by the Jewish Orthodox Women's Medical Association. Every week, hear from expert medical professionals as they share up-to-date insights on health topics to help you live your best life physically, mentally, and emotionally. Join us as we navigate the ever-changing landscape of healthcare and strive to improve the health of the Orthodox Jewish community.
Please note, this episode contains sensitive topics that are intended for mature audiences. Listener discretion is advised. Welcome to the JOWMA podcast. I'm your host, Jennie Berkovich, board-certified pediatrician and director of education for JOWMA. Before I tell you about my next guest, I need to tell you all about Tovedo. We've heard so much on even this podcast about the importance of limiting screen time, but for many of us, myself included, the reality is that sometimes we need to figure out how to keep our kids entertained and occupied, whether it's because we have to work, we have to prepare for something, kids are home unexpectedly if they're not feeling good, or even during travel. Tovedo is here to make that a really positive experience. You don't have to worry about what they're watching, what they're being exposed to. Really, really wonderful content. I love it. My kids really love it, and I cannot recommend it highly enough. Use promo code JOWMA10 for $10 off on tovedo.com. I now want to welcome my very good friend, Dr. Gail Gutman, for a conversation about eating disorders and how to recognize them in adolescents. It was a really, really great conversation that I hope you all enjoy. Dr. Gutman is a board-certified pediatrician and just finished a fellowship in adolescent medicine at Cohen Children's Medical Center. She will be an adolescent medicine attending at Columbia University Medical Center in August, and her clinical interests include eating disorders, which you will hear a lot about, pediatric gynecology, and promoting healthy habits in teenagers. Most recently, her research focused on the change in the quality and outcome of eating disorders on patients that presented during the COVID-19 pandemic. She also served for 2 years as the co-chair of JOWMA's Teen Health Committee. Welcome, Dr. Gutman.
Hi, Dr. Gutman. Welcome.
Hi, I'm so excited to be here.
You and I have been having a lot of offline conversations about eating disorders and the types of things that you see in your specialty. And so I was really excited to get a chance to talk to you about this and make a whole episode about it. But before we get into all of that, you have a very interesting specialty. You are a pediatrician that specializes in adolescent medicine, which a lot of people may not even realize that is a specialty. So tell me a little bit about what you do as a specialist in this.
Yeah, great question. So adolescent medicine, you can come to from either pediatrics, internal medicine, or family medicine. And it's a 3-year fellowship, or if you come from internal medicine, it could be a 2-year fellowship, but it's kind of the idea of it is like all issues that affect adolescents. So that includes eating disorders, and that includes a lot of like gynecologic issues for girls. And then it includes sexual health, and then it also includes a lot of primary care and school-based health for that population. So the idea is that this is a really vulnerable population. It's not necessarily a population that general pediatricians always feel the most comfortable with, treating and managing, especially the higher risk or higher complexity kids. So that's the idea behind the specialty.
It's so interesting. I didn't realize that people can go into it not being trained in pediatrics. I always thought it was an exclusive pediatric specialty.
Yeah, no, you can go from internal medicine or family. And then actually, if you go from those, because of like ACGME requirements, it can technically be a 2-year fellowship. Sometimes you match at a place anyway where you have to do 3 years, but yeah, it's very
How
interesting.
interesting. Okay, so you mentioned one of the things that adolescent medicine doctors see are eating disorders, and this is sort of I think what prompted the discussion because I'm a general pediatrician. I was mentioning to you like, hey, I'm seeing a lot of eating disorders. Is this just anecdotal, or is there truly been an increase in this incidence? So I'm curious what the literature is showing and what you're seeing on a I guess bigger scale because obviously you see more of these patients than I do. Is there truly an increase? And if so, what are some thoughts about why that is?
Yeah, so great question. And I'm a very good person to ask because this is actually part of what my fellowship research project was. So I just finished fellowship at Cohen Children's Medical Center at Long Island Jewish Hospital, which we see probably at least one of the highest eating disorder centers for sure in the tri-state area and probably in the country. So, and for sure, during the pandemic, there was a huge rise globally in eating disorders, both in the inpatient and outpatient setting. And what inpatient and outpatient means, at least in the medical context, is so kids that were presenting to an emergency room and then getting admitted to an inpatient setting, and kids that were presenting to an outpatient medical setting, like an adolescent medicine office. And in our office, like so from in the like peak pandemic time, from 2020 to 2021, that time, outpatient, the rates more than doubled, and now are still higher than the baseline. So I don't have like the actual numbers off the top of my head, but it's coming down a little bit, but it's still way higher than the baseline. And that's just for the outpatient. And then in the inpatient side of things, so that's the people that either get sent from our outpatient office or that present to the emergency room for whatever reason. Sometimes they're sent by their pediatrician, sometimes they're at home and completely refusing to eat, or and parents kind of feel like they don't have another place to take them. They go to the emergency room and then they end up getting admitted to the hospital. That also drastically increased. I don't know the specific numbers, but just like anecdotally, when my first day of fellowship, there were 14 patients on the floor, and I'm told that somebody who graduated like 6 years before me, her first day of fellowship, there were 0 patients on the floor. So it's just like a huge, huge increase.
Is that true for across the board of all eating disorder diagnoses? As a general pediatrician, and what we were seeing a lot during the height of the pandemic was a lot of disordered eating that resulted in tremendous amount of weight gain. So obviously that definitely right can be a type of eating disorder, but I'm curious of what you were seeing was reflective of every single type of eating disorder diagnosis, or was there one or two that stood out as being a little bit more of like an outlier?
Yeah, so that's a great question. So in adolescent medicine, I would say the least of what we see is binge eating disorder, and that's because it tends to be something that general pediatricians are probably a little bit more comfortable managing, although we can get into if that's appropriate or not, but I think just in general, there's not binge eating disorder and disorders of kind of being overweight are not necessarily as scary medically in the moment and acutely
Yeah.
that we don't necessarily get referrals for those as much. And then also because at least at Cohen's, there's a separate weight management clinic. We have an obesity specialist. So she's seeing tons of, binge eating disorder patients. But that it just, so we don't see it necessarily as much in adolescent medicine because there's other outlets for those, there's other places for those patients to get to. In the primary care setting, which is another huge part of adolescent medicine, we do see that a lot, and kind of manage it not necessarily from the same lens as like how we would treat other eating disorders. Um, you asked, is the increase in all eating disorders. So interestingly, this was another thing that my research looked at in fellowship. I looked at the DSM, which is the Diagnostic Statistics Manual for Psychiatric Illnesses. I looked at how the DSM diagnoses compared in 2014 to 2015 compared to 2020 to 2021. And what I found was, so on a per month basis, basically the rate of bulimia stayed the same. Basically, it was like something, and this is in the adolescent population, but it was something like 3.5 per month, patients with bulimia. And we can get into what that means, but what that means really, to make a diagnosis of bulimia, the patient has to be binging and compensating. So somebody who restricts themselves and loses weight and makes themselves throw up gets a diagnosis of anorexia, not a diagnosis of bulimia. So just to kind of, that's just a,
And that's an important distinction, right? And we can maybe
yeah,
get into this a little bit because the treatment approach is different, and also the um how the recovery rate, right? And all of that,
yeah,
right?
ex-
Statistically is
totally.
different. Yeah.
Yeah, totally. But what we found, so the rate of anorexia nervosa, which means that the patient is underweight by restriction, possibly also with like a binge purge component and possibly not. But um, a patient who is underweight and has anorexia nervosa, it increased a little. It was something like it went from like 10 per month to 13 per month or something like that. But the rates of atypical anorexia, which is a subset of something called OSFED, other specified feeding or eating disorders, but what it means really is that somebody lost a drastic amount of weight, but is not underweight, not by so is still above the 10th percentile BMI, or is above 85% of their ideal body weight. That nearly tripled that that rate. Um, and then also the rate of ARFID, which stands for avoidant restrictive food intake disorder, that also nearly tripled. So
So I think the natural question, right, is to why you're seeing such huge spikes.
yeah,
So as I think when we talk about the pandemic and we talk about the increase in mental health disorders and diagnoses, right, we know that's complex, but to me kind of makes sense that you're seeing an increase, right, in eating disorders. But I feel like it's a little bit probably oversimplifying why we're seeing such a rise. And I've heard multiple theories about this where people think that when kids have an increase, let's say increased exposure to social media, and they're being shown unrealistic expectations for body image, and it's resulting in like distorted body image, right, that's leading to eating disorders. But again, I think you and I have talked about it, how that it's a little bit not the full truth. Certainly it's a component of truth, but it's not the full truth. So let's dive into why you think all of these spikes are happening.
yeah, it's a really good question. So overall, you know, um, eating disorders are a coping mechanism for something else, usually on some basic level. And so we know that during COVID in adolescence, mental illness totally shot up in basically every single like domain. So eating disorders are another area where that shot up. And actually interestingly, a lot of patients with the the comorbidity of like anxiety or self-injurious behavior like cutting and things like that didn't necessarily increase in eating disorder patients. A little bit, but not like so impressively. And so one kind of like thought about that is, well, this is their coping mechanism, right? So like,
Right.
so they're maybe they're not self-harming, but they're restricting. So that's one major thing. So eating disorders are a maladaptive coping mechanism. I think like at their heart of hearts, that's what they are. And and then the other thing is because I know body image comes up a lot. So body image, it plays a role um for sure in the development of an eating disorder. I think other like things that go under that are like clean eating and kind of like obsession with like if you look at social media and like a lot of kids they don't necessarily like they don't necessarily want to be skinny. I don't know that that's in the way that it was in when you and I were in high school. Like but they wanna eat clean and they wanna be healthy and they wanna be fit. And then something that happened during the pandemic was that people were home and not exercising as much anymore and eating a ton, so they put on a little bit of weight, and so then they lost a little bit of weight, and what we know is that weight loss itself can trigger an eating disorder. So even if it starts out as like a normal, "Oh, like I just was going out for a walk every day and I lost 5 pounds," that could trigger this, like, really.
Because of like positive reinforcement that they're getting about it, and then kind of get hooked on that.
Yeah, because of positive reinforcement, and then also, I mean, this is not, like, proven, but there's a little bit of, like, malnutrition to the brain. We always say and we can get to this later, but, like, we always say the beginning of eating disorder treatment, it's really, like, you have to get enough nutrition to the brain. So it's really, really hard to get somebody who is, like, really, really underweight to understand rationally, like, why they're so disordered and why this doesn't make any sense. So the same way, like when somebody loses a little bit of weight, their brain is a little bit less nourished and it makes it kind of like it just all of a sudden makes sense. Like, oh, I should restrict everything. I should, have all these very dire actions.
So listen, there's a lot of people who have exposure to this type of social media content, and there's a lot of people who lose a little bit of weight, and not all those people develop eating disorders, right? So there is an additional piece here. There must be.
100%. And I think that's like a huge thing. If and one of the like caveats that I have about like doing this type of talk is like if you get into this enough, there's kind of two ways of thinking about this.
Mhm.
You and I could probably find reasons why everyone that we know has disordered eating and has body image issues. And that's huge. And I'm not invalidating that at all. But that could potentially pathologize all of us. And we don't I don't necessarily think that we need to do that. I mean, look, I think that's a great goal for like life to be able to really fix everyone's relationships with their body and relationships with food. But at the end of the day, that's not kids that are really, really, these eating disorders are about so much more than body image. They're about, we don't necessarily know what they're about. Like, I don't, that's one of the things that I think I've definitely learned over fellowship. We don't necessarily know what causes eating disorders. We don't know what they're like represented. Some people will say, oh, it's about control. Oh, it's about perfectionism. Sometimes, sometimes not. But what we know is what fixes an eating disorder, and that is normal eating and almost like forcing the patient to eat normally and structured normal eating. If that makes sense. I don't know
It
if it
makes
does.
sense. It makes sense. Something that I've really struggled with is this idea that is, especially in general pediatrics, when I take care of all kids, but especially like preteen and teens, I make a point to get an idea of like how they're eating. And, during well visits, we talk a lot about a diet. We talk a lot about exercise. I make a point to like even write on the prescription pad, 30 minutes of exercise each day, ideally outdoors. That's like my thing. And all my patients
Yeah,
know, like, right, I'm a big proponent of that. Movement is medicine, all of that. And talking about like making good choices and feeling like the food that you're taking into your body is something that you're going to feel good about and that's going to give you energy. And I'm very careful to avoid pointing at a growth chart or to having any certain numbers or goals, right? Just because when I trained like this was very much like a concern that you would
right,
misspeak or God forbid, like trigger someone to have disordered eating because of what
right,
you shared with them. But then when I'm faced with girls, really specifically, that's really been my experience, who have some component of disorder eating or even a full blown eating disorder. I don't know that I've had the right tools to have those conversations with them about food, because then, right, they don't have a logical thought about eating and about moving.
yeah,
And so I don't want to tell them the wrong thing of how to have a relationship with food, because what I've seen adolescent medicine doctors do when I refer is they give them very strict right, eating schedules, eating amounts, calories, supervised eating, right? And all of that doesn't resonate super well with me, because it's like goes so against how I would typically approach like a
right,
relationship with food. So I'm curious how you approach that, because your background is pediatrics, right? Before
yeah.
adolescent medicine. So how do you have those conversations, and how do you think about right, having a prescriptive eating and exercise plan, which often is no exercise, right, for a given
Right,
amount of time?
right. So I guess a couple of things. Um, I think one of the reasons why seeing an adolescent medicine specialist works is because there's this kind of idea like you're going to the eating disorder doctor and they're telling you what to do. So it makes sense that like you as the general pediatrician in that context can't necessarily give that advice because
Yeah,
it's not the same, it's not coming from the same place. And I think
yeah,
one of the benefits of an adult, one of the roles of the adolescent medicine doctor is accountability for the patient and for the family. And so that's I think a huge piece of like how adolescent medicine plays in. Also, of course, there's maintaining medical stability and ensuring that the caloric amount that you're prescribing isn't, there's other nuance to it, but that's a huge thing. So, and then a lot of times there's questions from pediatricians like, "Oh my god, how do I how do I make sure that I don't give this kid an eating disorder?" Like
yeah,
I went to go talk about and on the other side, a lot of kids come to adolescent medicine and they're like, "Yeah, my pediatrician gave me an eating disorder because they made me feel bad
yeah,
about." So, but what we always tons and tons of kids get treated for obesity, get counseled on obesity. And and a very small percentage of those become very sick with an eating disorder, and so it's a combination. It's always, 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 I think, going to be a combination of like, how was the counseling, but also who's the kid, and like genetically, what are they predisposed to, and environmentally, what do they have going for or against them. Um, Things that like I think I I wish we could all just have a little bit more in our arsenals is just this understanding of like 3 balanced meals a day. Like, I think generally, I don't know about you, I mean, you would know better than me. When I was in residency, I feel like every kid that I saw that loved vegetables was at a healthy weight. And, like, the kids that I saw that were overweight, they just didn't, like, really like fruits and vegetables. And so, like, I think if that was the focus of the conversation more than, like, cut out juice or, like, cut out soda or cut out donut, whatever it is, or, like, snack, I don't know, sometimes I feel like we get this advice that it's like, I could never, I don't like, I was with a pediatrician once that told their patient, like, "Only have 2 junk food twice a week." I have junk food once a day. I don't, I mean, like,
Yeah,
I
so
mean,
I think obviously depends on the patient and depends on the
yeah,
family,
yeah,
but and by the way, I full disclosure, I've definitely seen kids who are overweight who love fruits and vegetables.
okay, fine.
But I agree with you. It's probably not the majority. But in general, I agree with the approach of like adding stuff in as
Yeah,
opposed to
instead of cutting.
taking stuff out. Well, at the same time, right, we're talking about generally healthy kids who, right, are seeing their pediatrician and don't have any associated disorders, right? Right. If I think if you and I had an endocrinologist here, they
Of
probably would
course.
not agree with any of this and say, but no
Yeah,
juice, no junk food, right? All of that, but recognizing that they take care of a much different population. Now we're dealing with right diabetes and all of that. So overwhelmingly, yes, I do think we would probably be much more successful in our nutrition counseling in
right,
pediatrics if we worked on adding stuff in as opposed to taking stuff out.
right, right. Yeah, I mean, I think that's basically that's the point. Like, and I just think if we could make things about falling in love with fruits and vegetables and falling in love with exercise, like, I mean, you and I both run, and that's a big part of our friendship offline. But like, that is seriously, I think, just if you could get kids like interest, it's so fun to fall in love with the sport and like fall in love with being outdoors. And if that was like the focus of how we counsel kids, I think that's a huge difference from like, just saying, oh, like you're overweight and you
Yeah.
need to um like cut out whatever drink you have.
That makes a lot of sense. I want to move the conversation to what parents can do if they think there is a problem. I heard a line recently, actually from a therapist who specializes in eating disorder. It's somebody that I refer to often. She said something like, "Eating disorders thrive on secrecy." And that was very powerful to me because some of
Yeah,
the patients that I've been taking care of over the last several years, that's kind of how it comes to the parents' radar, right? How it gets on the
yes,
radar if they maybe find maybe some messages from friends, right, that they maybe happen to see or like find, I don't know,
yeah,
laxatives or something, right, in a drawer or in the garbage can, and or they notice that maybe lunches are coming home and not fully eaten, or lunches are in the garbage. So what are maybe some red flags for parents or caregivers or maybe even teachers? That someone in their life it might be having some disordered eating.
yeah. Good question. So first of all, I would say to use visits to the pediatrician, very, those kids, generally speaking, don't lose weight. And when a kid loses weight, right, like, kids are growing, like, even if they're a little bit overweight, maybe they'll maintain it, but it's really to justify, for most kids, to justify weight loss, is it should always like raise a little bit of like a, oh, like, why did my kid lose a pound this year? That, like, that just, so those growth curves really can be very, very telling. And I would say parents should definitely use visits to the pediatrician, like, as kind of a marker of that. And then, the other thing is that, I guess 2 things. One, if there's any kind of like intense rigidity coming from the kid, and I always say, like, in our community, like, all of a sudden this obsession with like having an extra level of cautious, like, if it's not like what your not like what your family
Yeah.
does, then all of a sudden, and it's like, okay, like, things like that, any kinds of food rules like vegetarianism, veganism, oh, I'm gonna cut out carbs, I'm gonna no more processed sugars, whatever those things are. Those are, I don't know, red flags all the time, but they're like maroon or pink flags. They're like they're not necessarily normal. But the other thing, and this is harder to like realize, but it's really important. Uh Eating just kids with eating disorders don't want to get better from the eating disorder. They are right, like it's a disease that a person that has it likes it and wants to keep it. And so
It's one of the
therefore,
many challenges of treating it, right? Is
challenge. It's
that
a huge
they don't
challenge.
feel bad about it.
Yeah. And so they might be in a good mood
Yeah.
and they might be doing really well. And when and you might kind of like see your kid and think like, oh, she's thriving, like, oh, she's so happy, and whatever it is, and that's actually like a bad sign. So, and then actually what happens is that as they start to get better from the eating disorder, they usually are much more miserable in the very beginning of that. Um, and so, and so it from a parent, I think one of the things to just always keep in mind is like this is not and kids with eating disorders do excellent in school. Like school can never be a marker of like, oh, well, look, but she's getting great grades. How sick could she, or he, right? Guys get eating disorders also. How sick could they really be?
Yeah.
Kids with eating disorders can appear very, very well. And that is something to just, I think all parents should really be aware of that.
Very, very subtle findings, and also I think unique to eating disorders because there's a huge psychiatric component, but it's not all psychiatric, right? And like in
Yeah.
a lot of psychiatric things, like someone is depressed, like right, we know what's going on, right? They're
Yeah.
all of a sudden right have a decreased interest or increased sleepiness, or just kind of seem not themselves, or they're very anxious. And here,
Right.
this is almost the opposite. So certainly the findings can be very subtle. So let's say, right, we have a parent who picked up on some issues. They're bringing their child to the pediatrician. They get on the scale, maybe a little bit of weight loss, maybe not, right? We know a lot of disordered eating doesn't necessarily have to have weight loss or have a child be underweight.
Mhm.
And the pediatrician maybe does some labs. All the labs are normal. What's next?
Yes, it's a good question. I mean, I would say definitely talk to the pediatrician at that point, and because it really would be like a case by case basis. But then the other thing is it's always beneficial to take your child to a therapist. And I think especially one that specializes in eating disorders, but that can sometimes be hard to find. So if you want to start with one that's not, I would just make sure that that therapist is at least consulting with somebody who specializes in eating disorders. And the reason for that is because of what I said before, that therapists really are trained um, for the kids, for their patients to feel well. And so for someone who's not necessarily specialized in eating disorders, they might not know that the kid presenting well and presenting kind of well adjusted and happy is actually because they have this coping mechanism of restrictive eating or disordered eating or whatever it is. But I think if if the patient is medically stable and the pediatrician feels that it can stay with the pediatrician and work with the therapist. You don't necessarily need to refer to adolescent medicine, but you absolutely can and could and should. And adolescent medicine, the reason I'm saying it is because adolescent medicine is a very like niche field. So I don't know who's listening to this, but there might not be adolescent medicine
Yeah.
where they are. So, but there's always Zoom therapists available. There's always virtual therapy, and there's always the pediatrician. And those are two really, really great places to start.
What role does a nutritionist play in all of this? Because I think a lot of parents, the instinct is, oh, maybe my child just needs to have a conversation with somebody and we can work out like a plan for what they should be eating and what's healthy. And so they just take someone to either like a nutritionist or a registered dietitian. Is that the right way to go?
Yeah, I mean, nutritionists are paramount to eating disorder treatment and to getting, especially in kids that need to be weight restored and need to gain weight, that nutritionists are totally, totally imperative. Um, and a lot of times that could work. A lot of times there's different kind of like modalities of eating disorder treatment. One of the most famous being family-based therapy. And what that is like a therapist who kind of also acts as the nutritionist and like and oftentimes has an RD and is a registered dietitian and just works with the family and the kid on how to just like get the weight back on. And there's different phases of it and it's a whole process. But So absolutely, nutritionists are really important. I would just say that nutritionists should be working in conjunction with a medical doctor and a therapist. So those are really like the three facets of eating disorder treatment are medical, nutritional, and psychological.
Are there is we talked a little bit about like red flags. Is there any like prevention strategies, right? Or anything that you can kind of put into motion as a parent or caregiver, depending on the age of your child, to prevent? And of course, we can't fully prevent, but I like to use the term reduce the risk, right? So when
Right.
you put on a seatbelt, right, you're not preventing, right, getting hurt in a car accident, you're reducing the risk. Is there
Reducing
anything that you can do to reduce the risk of someone in your life developing an eating disorder?
It's a really great question. If you were asking, let's say Marcy Forda, who is the co-founder founder of Otsme, who I only spoke to once, but I've listened to her on podcasts. She's awesome. She has an entire like platform and modality of how she's getting into high schools and middle schools early. Devorah Levinson also has a great presentation that she gives to girls. I don't necessarily have so much experience with that. Certainly in fellowship, I don't, it's definitely not like the medical side of things. And what I've actually been trained to learn is that sometimes these things could actually like a little bit give the idea to people and there is a concern about that. So that's I know like I trained with um Dr. Fisher, who's a very he's my the chief of adolescent medicine, and I I look up to him a lot, but he and many people know who he is, but he always says like that they used to give talks in schools and then they stopped because what they found was it was kind of giving kids ideas more than preventing. So that's one thought about it. But then if you talk to somebody like Marcy Forda or Devorah Levinson, they'll have another, so there's totally different viewpoints on that. What I would say, this is like just my non-evidence based personal opinion, is the way to prevent an eating disorder is to make it very normal to eat 3 balanced meals a day and snacks. And like that is and I just what I see ever so many people not doing, just like so many people like, oh, like, but whatever, how they, whether it's as a parent or for themselves, it's like they'll be at a, whatever, at a barbecue and there's potatoes and, oh, I'm not going to take the potatoes. I'm not going to, but it's just like, but I don't know. Don't we all eat 3 balanced? There, this is, you could have a conversation forever and there's 100 different opinions. But I think if we could make it really normal to eat normal food, I think that's the way to, like, hopefully prevent an eating disorder.
And I do want to emphasize that that's not necessarily such an easy thing when you have
No.
adolescents, right? Like every single
Yeah.
adolescent, I think that I've done a checkup, and even like the last 6 months, I'm just thinking like, right, I try to take a diet history during a well visit. Tell me what you eat.
Yeah,
For lunch? Like, no, no, for
totally.
breakfast. For breakfast. Oh no, I don't eat breakfast.
Right.
Right.
Everyone skips breakfast.
Right, everyone skips breakfast. For lunch, if there's time, or like, in high school, especially, in Jewish schools, like the girls are so busy and there's all these activities. Not in Jewish schools also, like in any schools, right?
Yeah,
Teens are always busy. There's always activities. So maybe they'll skip lunch, or they'll just have like a snack for lunch. And then for
right,
dinner, they're also probably, right, either at an activity or a friend's house. So you may not be having a family dinner. And so I don't want to minimize how challenging it is to enforce
totally.
that 3 balanced meals a day plan.
Right. And I don't know if you have this experience, but, like, with with weight management patients also, that is and so much of the time I'll see a kid with obesity and I'll say like, "Okay, so what'd you eat yesterday?" And they're, "Well, I skipped breakfast, I had a granola bar for lunch, and then I, had, like, salad." And it's just kind of like, "Come on, like like something is going on that we're not addressing, right?" And so I not that they're like lying, but I think that they're it's so hard for them to remember, and probably there's like an emotional component of not
Yeah.
necessarily knowing like when am I getting the calories in that I'm getting, right? And I've personally been there too. Like I've had times where it's like, oh, I think about like what did I eat yesterday if I'm trying to be like, healthy, whatever, and I think about what did I eat yesterday, and I'm like, "Oh, yeah, yeah, I only had this," and then it's like, "Oh, wait, no, I also had a snack." Okay, and then, and it's just like we 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 very much I think a lot of us, we just get into this kind of like weird, like not balanced mindset of eating.
I am curious that prevention programs, right, which I think primarily focus on like healthy body image and all of that,
Mhm.
have have backfired in some cases. I'm curious, has there been study on that? Is there like literature to say like this
Good
isn't a good
question.
idea?
I don't know totally. Um, I'm only speaking of it like anecdotally, so I'm not really sure what the literature is. But it's a good question.
Because I could see it being very beneficial in a preventative type of way where especially like in junior highs and in high schools hopefully before someone has a lot of exposure to social media or even like billboards and like
Mm,
outside media type of stuff to give them like a background of like, hey, a lot of what you're seeing isn't real and it's photoshopped and like this isn't like a healthy ideal and
right,
all of that. I, and actually somebody asked me this recently, is it a good idea to address eating disorders with your teenager if it's not something that you're worried about, but just kind of like bring it up to let them know,
right,
like, right, that if they have any concerns or if they have a friend who maybe, right, is exhibiting some of these signs, that a home is a safe place to talk about it. And my answer was yes, absolutely, because talking about it is not going to make someone have an eating disorder. So maybe that
right.
wasn't true.
I mean, it's like it so depends on the kid.
No.
I, I, it depends on the kid. I'm very like I don't know what makes right now. A lot of people say like, "Oh, well, of course eating disorders are spiking." Like there's so much social media. Like I don't know if I really buy that. When I watch TV now, there's way more body diversity than there was like when we were growing up and it was like Friends and Will and Grace, like that they were very thin, those women. So I don't know, and Ally McBeal and like I don't but we didn't have social media, so maybe, so we didn't have Photoshop in quite the same but I don't know. Maybe it's like a little bit of a cynical thing for me.
Yeah.
Like, I don't know what's gonna make eating disorders get prevented. I don't have a lot of faith in the idea of like promoting positive body image
Yeah.
as a great way out of eating disorders. Mostly because I think once somebody gets wrapped up in an eating disorder, it doesn't matter that they think that everybody is beautiful. Like people that are really, really sickly wrapped up in an eating disorder, it's so much more, I think it's so much more than body image. And so
I think
a little
what
bit
I
of a
think what
cynical
this is what I think, and again, we should do a study to prove this, but my an instinct when I hear you say that is that there is probably a component of disordered eating that you can prevent or decrease the risk of by doing these type of programs. But if someone is on the road for full blown anorexia, where God forbid they're going to need to be like admitted to the hospital or they need to see someone like you every week
yeah,
for weight checks, no amount of positive body image talk is going to prevent that. But if you have a girl who maybe has some mixed feelings or right isn't really sure or maybe has some
totally,
negative influences in her life and some positive ones, programs like that can be beneficial.
totally,
I
totally.
just made that up, but it
Yeah,
feels
no,
right.
I think that's totally right. And I think that's like as a society, we should be like going toward that idea. Like
Yeah.
I always tell the story, like when I first started fellowship, um, because when I first started fellowship and I was seeing all these eating disorder patients that I'd never seen before, and the nutritionists are, they're pushing like you should be having juice with every meal and you should be having like ice cream with, all the and it's like all these foods that I when I was in residency was taught like juice is empty calories, soda's empty calories. And then I realized, like, why am I calling juice empty calories if by definition it has calories, so it's not empty? Like, just like, and obviously because we mean it because of I understand that we mean it on this kind of nutritional, like what vitamins is it giving
Yes,
you
because
now?
you don't take care of toddlers. I have
Right.
to tell the toddlers not to
Right,
drink the juice.
right. But I really I was just like, "What?" Like, that's it changed a lot about how I
Yeah.
thought about
I remember hearing you say that, I think on a different panel we were on
yeah,
once
yeah,
about specifically that juice
about
example,
juice,
how
yeah.
it can be a really useful tool, right, for a specific patient population. So I do think it's good for caregivers and even general pediatricians like myself to like have that in mind where and in general avoid calling food good and bad, right? Food is
Yeah,
like any
exactly.
carb, like really, right?
Yeah.
But food is carb,
Right.
right? There's sometimes food, there's all the time food, and there's definitely food that we can be making a more frequent choice to put in our
Right,
bodies. But having
right.
this relationship of like labeling things good or bad, I think sometimes can go into the road of some disordered feelings about it.
Yeah, totally, and at the end of the day, like, you know every kid is different, but if for a healthy growing kid who is a healthy weight, like I don't know that we need to be quite as obsessed with like what each nutrient they're getting and if they're at like junk food versus whole food, like I think a lot of kids, but then somebody who's in weight management or endocrinology, they might say no, but the entire family needs to be on board because so there's it's a never ending conversation.
For sure. Well, listen, this was so insightful. It's probably just scratched the surface of eating disorders and the type of things that you do and the very challenging diagnoses that you take care of. So thank you so much for your time and
Ew,
for
so
spending a little bit
fun.
of our afternoon together.
Thank you, me too.
Thank you for listening to the JOWMA podcast. We welcome your feedback and ideas for future episodes. Send us an email at health@jowma.org. Don't forget to subscribe, rate, and review us on your favorite podcast platform.